Meet Rebecca. She is a 64-year-old woman who was told in 2024 that she needed to prepare for dialysis. Sounds terrifying, doesn't it? But Rebecca refused to accept that fate. Instead of giving up, she fought back. She educated herself, changed her lifestyle, and found a natural method that gave her something her doctors never could: hope. She was guided on how to eat healthier and how to improve her health markers through natural therapies instead of relying solely on medications. Most importantly, she was given the opportunity to take control of her own health. The result? In just 10 days, her health improved so significantly that she has not needed dialysis to this day. Just think about that for a moment. She was on the verge of end-stage kidney failure, yet her turnaround was so remarkable that her case was even published in a study. If she could improve so much in just 10 days, what could you achieve? Because today's video isn't just about her story, it's entirely about what you can do to improve naturally, just like she did. Today, I'm bringing you some groundbreaking, scientifically proven innovations in the world of natural treatments for kidney disease. The reason I introduced this video with Rebecca's story isn't just to offer hope, not just to show you that this terrifying disease can be defeated. It's also because I want to share with you some powerful, overlooked remedies that are helping people like Rebecca beat the odds, remedies that doctors rarely, if ever, talk about. I want to show you why herbal medicine can be more effective, if not better, than ARBs for chronic kidney disease. I also want to share an innovative treatment for diabetes. And I've saved the best for last. I'll reveal a root that can cut your urine protein levels in half, so don't miss the end of this video. And did I mention that this is a remedy you might already have in your kitchen? But I'm not just sharing remedies today. I'll also make sure you know how to incorporate them into your treatment plan. Because no two patients are the same, and there is no one-size-fits-all approach to kidney disease. Rebecca had a personalized plan, and that's why she was able to improve. There's a lot to cover today, and no time to waste. Let's dive right into why I say herbal medicine can outperform some of the most widely prescribed medications for chronic kidney disease. Because a picture is worth 1,000 words, let's start there. Here, you can see the GFR decline rate of patients using ARBs compared to those using only herbal remedies over a span of 12 years. Always remember, today, ARBs and ACE inhibitors are considered the gold standard for slowing chronic kidney disease. Your doctor will likely prescribe you drugs like lisinopril or losartan if you have CKD. But just look at what these herbal remedies have achieved. Because I know you might be thinking right now, are you seriously telling me I'm dealing with constant fatigue, muscle weakness, and high potassium levels from my losartan without any real benefit? I'm not the one saying that, the authors of this recent study are. As you can see, they compared the effectiveness of ARBs with traditional Chinese medicine, TCM, herbal therapies in patients with early-stage diabetic kidney disease. And here's the truly shocking part. Patients with diabetes and early-stage kidney disease are considered ideal candidates for ARBs. Yet even in this perfect scenario, herbal medicine performed better. So the real question is, why isn't anyone talking about this? And more importantly, why aren't patients being told that they have options? We're going to break it all down, how these herbs work, how to use them, and what it all means for you. So stay with me, because what I'm about to share next will surprise you, starting with TCM's alternative to ARBs. Right now, the main prescription from traditional Chinese medicine, TCM, when it comes to kidney disease and diabetes is a remedy called Panax Noto Jinseng. This is an ancient remedy that is finally being gradually adopted into modern treatment for chronic kidney disease. In fact, recent research shows that the antioxidants present in this remedy are highly effective in protecting the kidneys. It can also enhance blood flow, which is a great way to improve kidney function. In a study involving 1,918 patients with diabetes and kidney disease, those who took Panax Noto Ginseng not only slowed down the progression of kidney disease but actually reversed it. Yes, truly reversed it. This herb works by reducing oxidative stress and soothing inflammation that drives the progression of chronic kidney disease. It even significantly reduces proteinuria, a crucial step in maintaining stable kidney function. But here's the best part: even if you don't have diabetes, you can still benefit from this remedy. Panax Noto Ginseng has also been shown to lower blood pressure and improve vascular health, making it an excellent choice for anyone dealing with chronic kidney disease. And one more thing, not all types of ginseng are created equal. There are 3 main types of ginseng on the market, and you should know which one to choose. The one in the middle is red Panax ginseng, rare and expensive. The one on the right is Asian ginseng, easier to find but not as effective. Then there is Panax Noto Ginseng. This is the one you want to look for, and it should be relatively easy to find in extract form. Just make sure the label says Noto Ginseng and not just ginseng. Now that you know what to look for, let's talk about why this remedy is so effective. Panax Noto Ginseng mainly helps by blocking oxidative stress, one of the main pathways through which high blood pressure and diabetes damage the kidneys. Now, folks, this is very important. There is no way to stop the progression of chronic kidney disease unless you address the root cause. This is something I try to teach all my patients. The only way you can beat this disease is with a 2-pronged approach. The first prong is stopping the cause of the damage, as I mentioned earlier. In Rebecca's case, this was both diabetes and high blood pressure. It's very common for chronic kidney disease patients to struggle with one of these issues, or in some cases, both. So, to improve, Rebecca was given every tool she needed: the right medications, powerful natural remedies, and lifestyle changes that would help bring her blood pressure and blood sugar back to safe levels. That's the first prong. Now, the second prong is mainly about reducing the toxic load on the kidneys. This is crucial. Most of the toxins that your kidneys struggle to filter come from your diet, especially from protein. This is why patients who switch to a kidney-friendly diet often see their kidney function stabilize or even improve. And that's the second prong. When the 2-pronged approach is done properly, the results can be life-changing, and that's exactly what happened with Rebecca. Now you might be thinking, okay, but what should I do next? Because here's the truth: no 2 patients are the same. What worked for Rebecca might not be exactly what you need. That's why having a personalized plan is the best way to achieve real, measurable improvements in your kidney health. Let's move on together to the next step. Let's talk about what is perhaps the most extensively researched CKD remedy from traditional Chinese medicine, a remedy considered a natural ACE inhibitor that protects the kidneys from high blood pressure. This is very exciting for us because drugs like ARBs are one of the main sources of kidney toxicity. But what if there were a remedy that could outperform ARBs and ACE inhibitors without adding more strain on the kidneys? In fact, if we want remedies to perform better than ARBs and ACE inhibitors, it's clear we need something equally effective at lowering blood pressure, right? And what is that remedy? It's a root called Salvia miltiorhiza, and you may have heard me mention it here on the channel. In fact, Salvia miltiorhiza has recently gained attention because it was tested in a very large and important study and proved to be extremely effective at reducing creatinine levels. In this study, patients treated with this remedy saw their creatinine levels drop significantly, by 1469 points. Now, this is a different study from the one I showed you earlier. In this study, they used Salvia miltiorhiza in combination with ARBs or ACE inhibitors, not as a replacement. I find this very interesting. In fact, it tells us that this remedy can be taken alongside your standard medication, and you would still get significant benefits. This might be because the main way Salvia miltiorhiza helps is by improving microcirculation in the kidneys. Now, I won't go deep into this remedy today. Alright, it's almost time to discuss another amazing remedy that could make a big difference with proteinuria. But first, a question: should you throw ARBs and ACE inhibitors out the window and switch to something more natural instead? I understand that learning about success stories like Rebecca's and discovering natural remedies that act like ACE inhibitors but without side effects might make you think it's time to rethink the entire medical approach to chronic kidney disease. But I want to be very clear about this: I am not advising you to do so. I would never recommend that you stop taking your medications. Remember what I said about the two-pronged approach? There's no way to halt the progression of chronic kidney disease unless the underlying cause of kidney damage is addressed. For a patient like Rebecca, who has a long history of diabetes, it would be very difficult to keep fasting blood sugar consistently below 130 without medication. But I often see patients who are afraid to take medication because they don't want to harm their kidneys. So what should you do? What I recommend is an integrated approach. While you should continue to rely on modern medicine, you should also add the right diet, proper lifestyle choices, and, when appropriate, supplements and natural remedies. This way, you'll be able to use ACE inhibitors, ARBs, and other drugs at the lowest effective doses. And that's how you maximize benefits and minimize side effects. Alright, let me know if this is clear or if you want more information. Please write it down in the comments section. Now, there's another remedy I want to share with you today. This is an extremely powerful way to address one of the main reasons why CKD patients are prescribed ARBs and ACE inhibitors: proteinuria. If your proteinuria is high, your treatment plan should differ significantly from someone who doesn't have high proteinuria. This study was recently published, and it's a meta-analysis of several randomized controlled trials on a home remedy. This might be something you already have in your kitchen. And let me tell you, it's not every day that you find a meta-analysis about something like this. So what is so special about this home remedy that it deserves such attention? As you can see from one of the trials included in this meta-analysis, the patient's proteinuria was reduced by half. There's only one remedy capable of doing that, so start searching your kitchen for turmeric. Now, if I were to recommend a way to reduce proteinuria for one of my patients today, I wouldn't necessarily suggest turmeric. In fact, while turmeric is wonderful, as this recent meta-analysis has shown, it has one issue: its oxalate content, which isn't necessarily a big problem. But you see, for patients who have fluid intake restrictions, adding more oxalate might not be ideal. The solution? There are many brands that offer 95% curcumin extracts, and these products contain almost no oxalates. So choose one of these supplements if you're dealing with proteinuria and are concerned about oxalate. Today, we've learned how to use some remedies and supplements to protect our kidneys from diabetes, high blood pressure, and proteinuria. When Mr. X began dialysis 3 times a week, he never thought he had a chance. But after 514 days of dialysis, he fully recovered and was able to avoid being tied to a machine for life. How to escape dialysis and survive. Today, I want to focus on how to escape dialysis and survive. According to a recent study published in the prestigious journal PLOS Medicine, 4% of chronic dialysis patients are able to stop dialysis due to kidney function recovery, even after months or years on dialysis. However, researchers believe that even when patients have a chance of recovery, they often don't know, because doctors usually don't check. Imagine being tied to a machine for life simply because your doctor stopped checking your kidney function once you started dialysis. Today, researchers are studying patients who can recover from dialysis, like our Mr. X, to understand what factors might predict whether a patient has a chance to recover and escape dialysis. The story of Mr. X, a true story. Mr. X's story is not something I made up. It's a real story. It was documented in a published case report in a respected journal. At the age of 49, Mr. X was hospitalized due to unexplained headaches and vomiting. His blood pressure was extremely high, measuring 228/138 mmHg. His creatinine levels were also elevated, indicating that his kidneys were not functioning well. He was later diagnosed with hemolytic uremic syndrome, a blood disorder that affects the kidneys. However, it was the treatment for this condition that caused his kidneys to completely shut down. Within a few days, he became anuric, producing no urine, and had to start dialysis. He underwent dialysis for nearly a year and a half. But then, he recovered. In today's video, I want to talk about Mr. X. I'll call him Mr. X to protect his identity, because he's not the only one who has escaped dialysis due to chronic kidney disease, and survived. Yes, it can happen. More than 4% of chronic dialysis patients get off dialysis. That's why researchers are working to develop guidelines, a series of signs and symptoms that could indicate when a dialysis patient might actually no longer need dialysis. The problem is, currently, these guidelines don't exist. This means that once a patient starts dialysis, it's considered a lifelong commitment, even in the rare cases where dialysis is no longer needed. Now, if you want to make sure this doesn't happen to you or someone you love, there are 5 signs and symptoms you should watch for. This is how Mr. X escaped dialysis. After a year on dialysis, doctors began evaluating Mr. X's sister as a potential kidney donor. They didn't believe he had a chance, until he started developing symptoms of dialysis intolerance, such as cramping and low blood pressure, which were the first signs. The second sign was that he began skipping dialysis sessions whenever possible. After another month, he started feeling nauseous during each dialysis session. Eventually, dialysis therapy was reduced to once a week. Then, he encountered another issue during dialysis. He couldn't complete a session without needing to urinate. That was when his doctors decided to recheck his kidney function. When the doctors found out, they were shocked. Mr. X's kidney function, after 18 months on dialysis, had returned to 21%. Enough to sustain him without dialysis. Moreover, his blood pressure had dropped to 120/60. 514 days after beginning treatment, dialysis was stopped completely. The patient was monitored weekly. What the doctors discovered about him was, more on this later in this video. 5 signs a dialysis patient might no longer need dialysis. This situation is more common than people realize. So, what are the signs and symptoms that suggest a dialysis patient might not actually need dialysis? Low blood pressure. Many patients undergoing unnecessary dialysis develop low blood pressure during sessions. Cramps and fatigue. Patients whose kidney function recovers after starting dialysis often suffer from various issues caused by mineral and fluid imbalances induced by dialysis. Dialysis intolerance. dialysis can be very taxing on the body, especially if the patient no longer needs it. This may be noticed when symptoms like nausea and vomiting occur during sessions. Less need for dialysis. When patients feel they no longer need dialysis, many start skipping sessions or shortening their dialysis time. Urine output. All patients who have come off dialysis report an increase in urine output during dialysis, and some have to regularly interrupt their sessions to urinate. What to do if you experience any of these symptoms during dialysis? What should you do if you experience one or more of these symptoms during dialysis? While symptoms like nausea and low blood pressure during dialysis are common, they should always be reported. Let your dialysis team know if you experience any of these issues so they can try to help. However, these symptoms are not necessarily signs that a patient no longer needs dialysis. On the other hand, the need to urinate should never be underestimated. It means the kidneys are working. Patients undergoing dialysis who still produce urine should request regular kidney function tests. Yes, they should actively request this. Residual kidney function in dialysis patients is very rarely monitored, even in those who still have some urine output. Now, here's how the doctors realized that Mr. X no longer needed dialysis. For ways to maximize the chances of kidney function recovery. But I bet you're wondering what he did during those 514 days to maximize his chances of getting off dialysis. There are 4 ways to maximize the chances of kidney function recovery that work at all stages of kidney disease, even for those currently on dialysis. Take measures to fight anemia. Hemoglobin levels are a good predictor of survival rates in people on dialysis. They are also critical for managing fatigue. This means you should do everything within your power to combat anemia, the main cause of low hemoglobin levels. A simple tip to help with this is to eat iron-rich foods, such as spinach, kale, mustard greens, and beets, alongside vitamin C-rich foods, like kiwi, lemon, and strawberries. Doing this regularly will provide your body with enough bioavailable iron. If that's not sufficient, a multivitamin can also help. Manage blood pressure. People at all stages of kidney disease need to manage their blood pressure, including those on dialysis. While taking medications prescribed by your doctor is important, there are also natural methods that can help. If you need to manage high blood pressure, garlic is one of the best natural remedies you can use. It works quickly and can help manage both high blood pressure and cholesterol. Magnesium, both from food and supplements, will also benefit your blood pressure. Omega-3 fatty acids are another remedy that everyone should be using. Exercise. Current guidelines even recommend that dialysis patients exercise regularly, even during dialysis sessions if they are able. According to a recent study, incorporating exercise during dialysis sessions can be very beneficial. For those not on dialysis and aiming to improve their kidney function, consider that exercise is one of the best ways to boost blood circulation. Better circulation directly increases the rate at which blood is filtered through the kidneys, thereby improving kidney function. Lower cholesterol and improve heart health. Abnormal cholesterol levels cause plaque buildup in your arteries, making it easier for clots to form, which can lead to a heart attack or stroke. This is a serious and very common risk for people with kidney issues. In addition to exercising and following a plant-based diet, taking omega-3 supplements can significantly improve cholesterol levels. Omega-3 fatty acids are responsible for most of the health benefits associated with seafood-rich diets. They can help protect against heart disease and stroke, improve sleep quality, support bone and joint health, reduce liver fat, and are even associated with a lower risk of cancer. This is a supplement everyone should consider taking. Mr. X had a happy ending. Now, I bet you're curious whether Mr. X had a happy ending. He had his kidney function tested twice after getting off dialysis. The first time, 1 year after stopping dialysis, his GFR was 21. This falls under stage 4 chronic kidney disease, requiring medication but not dialysis. Then, 6 months later, he was tested again. This time, doctors were shocked to find that his kidney function had improved to 24, closer to stage 3 than needing dialysis. His blood pressure was normal, and he was very healthy. He was working full-time and enjoying his life. Not many patients on dialysis can expect to recover kidney function after more than a year on dialysis. But it can happen. There are several emerging treatments that may offer hope to people with chronic kidney disease. 3D printed kidneys are one such development, but mobile dialysis is even closer to reality. We are truly nearing the day when the first humans in history will receive a biological kidney. In the meantime, take good care of your kidneys and be kind to yourself. That's all for today. Thank you for following along.